Welcome to EO Talks, Eastern Oregon's very own talk show, only here on EO Alive.
Hey, Eastern Oregon, thank you for jumping in with us today. And like always, we're here on this for this COVID update, and it's good to have Carrie Brigiotti with me today. How are you doing? Man, it's beautiful out there. Have you seen the weather?
I have. I actually went and looked in the mirror not too long ago. My cheeks look kind of rosy, and I was like, oh my gosh, it's kind of warm today. I definitely feel like a little bit of a spring feeling today. So I'm happy to see the sun.
I know, it's crazy. It's so pretty. It just reminds you of spring. I'm sure people are excited to be getting out, and great news for our county last week to be, improving by 2 categories. Talk to us a little bit about that. We did talk to Matt Scarfo the other day about kind of the back end of what happened, but maybe talk about what kind of went into lobbying for on our behalf and getting us to switch 2 categories.
Yeah, I'm actually really glad that you asked about that. I was just kind of scribbling some notes down before we started about our numbers and where we stand and just kind of keeping track of that. So, we've talked before, we're in a warning week, I think is what they call it, where we kind of get the lay of the land and kind of gives us some inkling into what's going to happen next week, which will be a movement week. And so, obviously we keep really close tabs on our case counts, and we're able to run reports on the number of cases that we processed. And, sometimes what happens, I think this is helpful for people to understand, is that, the Oregon Health Authority will report out the cases that are processed the day before. So tomorrow, when you see the numbers come out from the Oregon Health Authority, they'll be the cases that we processed today. So we may not be able to complete an investigation in one day. So sometimes what will happen is that we'll go and we'll do that investigation after the Oregon Health Authority has already released the numbers. And we'll find that for whatever reason, that person may not be a Union County resident. And it doesn't happen a lot. For the most part, the cases that are reported in Union County do turn out to be Union County cases. But, sometimes through the process of talking with somebody, we'll realize that that case really does need to be transferred to another county, another state. And I will also say that sometimes that works against us too, because the same thing could happen in another county. A report might go to Loudoun County, and they do the investigation and find out that it's actually our case. And so then we get a case added after OHA has reported out the numbers. So we keep really close track of the numbers. We run a report. And sometimes what happens, and this is what happened last week, is that the numbers that got sent to our county commissioners definitely didn't match the numbers that we had in our database. So we really worked hard to make sure that the numbers that we had in our database and that were truly cases that were Union County cases were the numbers that OHA used to make those risk level determinations. So, as Commissioner Scarfo said, it definitely took some back and forth. We definitely made sure that they had accurate information. And in the end, gratefully, we were able to move down to the moderate risk category, which is really good news. And I'm really hoping that we can stay there next week. And, again, I understand that people are really eager to get back to some sense of normalcy. And I think, we've definitely demonstrated that we can follow the risk or the criteria that has been set forth that reduces our risk. And so as long as we can keep our case counts down, then hopefully we'll be able to maintain that risk category. The numbers right now, we're looking to have, in the 20 range right now for the 2-week period that will be used to determine the risk category that we're in for next time around. But I know I've said this to you before, I don't count the numbers until the end of the week when I actually know what the numbers are, because things can change. So I don't want to get people's hopes up, and I try not to get my hopes up, because I know how important it is for our businesses and our community to be able to be in these lower risk categories. And obviously I don't want a lot of COVID cases either.
So we needed to be under 45 cases in a 2-week period of time, and that's where we need to stay in order to stay at where we're at, right?
Correct. Yeah,
And
45, less than 45 cases for the moderate category.
okay. And so then when you said 20s, did you mean like for this week?
So right now we're in the middle of the second week
Right.
that will determine our risk. So, I mean, last week we had 21 cases.
Okay.
And so this week we've obviously already had one reported, and we'll probably have some reported tomorrow. So I'm not giving an exact number because they change every day, but we're still looking good. I guess that's so far.
Yeah. Well, and that's kind of that's kind of good. So then the next category, what would we have to be under to move another category down?
So to stay out of extreme, we have to have 59 or lower. So,
Okay.
we still definitely have some room to move. And so as long as we're under 60, we'll be able to be out of extreme. So the next category, like I said, 45 and above would be high until we get to 60, and then we'll move into the extreme. And I think the other thing,
yeah.
Oh, sorry, go ahead.
But if we're going the other way, if we're improving.
Oh, I think it's 20. I think we're already out. I don't think we have a chance at that, which is why I didn't bring it up. I'm pretty sure it's 20, but I'd have to pull up the risk grid, but I definitely think, or maybe 30. I apologize. I don't have it open.
No,
I think it might be less than 30.
Okay. Yeah. No, I was just like, if we're setting a goal to get better, then what would the next category be? Yeah. So good.
Yeah. I think it's less than 30.
Okay. Good. All righty. Well, and so the vaccination schedule is out and changing. Why don't we talk about that a little bit? Let me pull that up, and so then we can see where that's at.
Great. Yeah, I think one of the things that we've been talking about for quite some time is this phasing for vaccine. So we've been in the phase 1A group for quite some time. And then obviously we started the phase 1B, and it's really helpful to have that on the screen in January. And right now, as of March 1st, we're in phase 1B group 5, which is people 65 and older. So, anybody who is in that group or a group that came prior to that is eligible to get vaccinated now. The new news, I guess, is that on Friday, Governor Brown shared the next phases, which we've been waiting for quite some time. So as you can see on this form, there's a lot of detailed information, but the good news is that now we know when anybody in our state will be eligible. So you can see that the next group will be what they're calling group 6. They will begin being eligible at the end of March. And that will include people that are 45 to 64 with underlying health conditions, which are outlined on the next page. Certain classes of workers, people that live in certain settings. Again, this is all based on risk, like what people that are at highest risk for either contracting the virus or having serious or severe outcomes. And then it moves into multiple other groups, which I'm going to be honest with you, I don't think I want to read all of them. There's a lot of detail in this guidance, and I think it gets even more detailed when we get onto the next page, which outlines the essential worker categories that will fall into the frontline workers. Sorry, that's what we're calling it. And I think I would definitely encourage members of our community to take a look at this. I reviewed it today, and it seems fairly broad, but I think the general idea is that if you work in a job where you really don't have an option of working from home or working remotely, and you're interfacing with the public on a regular basis as part of your work, and you're not able to maintain physical distancing, then you'll be eligible in that group. So it really will open it up. And I hope that over the next month or two that we'll have increasing supplies of vaccine coming in, which will just allow us to get more of those folks that are in those expanded categories. And we'll also have more pharmacy partners coming online. Potentially we'll have primary care providers offering vaccines. So I know it's taken some time, but it'll just keep expanding until more people can access vaccine.
Good. Now, do you talk about for a minute the different, so there's a new vaccine that's coming online from Johnson & Johnson. Have we seen that, or have you heard any word about when we might have that here locally?
Yeah, so I was actually just on a call with the Oregon Public Health Authority that we hold every week, and they talked pretty extensively about this. Obviously, Oregon is going to receive a shipment of Johnson & Johnson vaccine, and that will be distributed to counties throughout the state, primarily to local public health authorities, which would be CHD. So I'm anticipating that over the next few weeks, we will receive a small allocation, and we're not talking about a lot of doses. So, I think we're a bit surprised. I don't think we were even expecting it. And I don't even think the state of Oregon was expecting it. I think they basically said, oh, hey, you can put in an order right now. So they did. And so now we're going to benefit from that. So it'll be a small allocation at first, then there'll be a couple week break. And then it sounds like we'll be able to get some more of the state. And then I assume that will also be distributed to counties. The good news about this vaccine, and I think the thing that everybody has been really eager about with this vaccine, is that at this point, the emergency use authorization that it has been given, it only requires one dose, which I know has a lot of appeal to a lot of folks. I do want to caution that based on the information that I was hearing on the call with the state today, is that even though the current authorization does have one dose, they're doing studies right now to test whether or not the efficacy of that vaccine changes with a second dose. And so down the line, it's possible that there could be a second dose that would be recommended with that vaccine. And I think one of the other things they talked about on the call, and I'm just sharing it because it was really interesting to me, is that I know that vaccine has also been touted as being potentially more effective on the variants. And I think one of the things that was helpful to hear is that because of the timelines for the different vaccines we have right now, the Moderna and the Pfizer, because it was out quite a few months ago, they didn't really actually have time to study its effectiveness against the variants in the trials because the variants weren't really on the scene, so to speak, at that point. And so because the Johnson & Johnson vaccine came later, they had the ability to test it against those variants. So I think right now we're still learning so much about these vaccines. We don't necessarily know that one is more effective than the other. We don't know whether or not boosters will be required at some point down the line. And so, I think it's just, there's a lot of information, a lot to learn. And I think that, we'll definitely do our best to offer that as we think through the best ways to use our small allocation and the best uses for that vaccine. But, hopefully it'll just give more people the option to get vaccinated.
Well, and how do you see that? And this might be a question that you might not know. Could you foresee that people might have a choice? Like, hey, I'll take this one or this one. Or, do you have any guidance on how you guys are going to handle the option of having a different kind of a vaccine?
We haven't really had a chance to think through that or talk through that. And I've been thinking about it a lot the last few days when I learned that we would be getting some. I think that there's a couple of different approaches we can take. One would be to think through, are there certain populations or groups in our community that it would be more efficient or effective to provide them with a single dose of vaccine? That would be one question. Like, for example, if you were going to somebody who was in their home, right? So if you have 250 people come to a vaccine clinic, you can serve all of those in one day. But if you're going to individual homes, it may take longer to do that. You don't get as many done in a day, so to speak. So, having to only go to somebody's home one time might be a benefit. The other benefit to that would be is that if there's somebody who's in the home and they can't leave the home to get vaccinated, being able to find them, to give them a second dose would probably be a little bit easier, because I think we also need to be planning for the fact that we might need to follow up with people that got that vaccine if at some point they decide a booster is needed. I think the other thing that I haven't fully researched yet is that if there are some people that can't get the Pfizer or Moderna vaccine because there's a component that they're allergic to, this might also be an option for them. So, I think there are definitely still some things to think through. And, one of those things may be giving people a choice, but we just haven't had time to do that planning yet. And that's something we'll be working on over the next few weeks.
I can imagine so. So people can still, and I'll put this up, they can still subscribe to this address. They can go to this location, and I would imagine there's some information they put in to register, and then as soon as they are eligible for the the vaccine, they're contacted. Is that how that works?
Yeah, so what we've done is we've set up this email listserv. So you just go put your email address in, and every time we open up a new group or we open up a new clinic more specifically, then we'll send out an email to that listserv so you can kind of keep track of when those are opening. We try and send them out like about an hour ahead of time before we open up a new vaccine clinic. So we'll say, hey, 65 and older, you're eligible this week. We're going to have a clinic on this day and this day. You can sign up at this time. And so it just gives people a heads up to go to that website so they don't have to keep refreshing or keep checking. It's just the best way to get like up-to-date information. We're also going to let you know when your second dose clinic will be available too, because when you come and get your first dose, we'll say you're going to be due on March 29th for your second dose. In those emails, we'll say, hey, if you got vaccinated and you're due on the 29th, sign up for this clinic or this clinic. So it's just a really easy way. All the information's in one spot. Then you don't have to keep checking our website or our social media. Really easy way to get the latest information. I did want to share that right now at this moment, we do not have any open clinics. We are vaccinating people in that 65 plus group this week, but those clinics already filled up. I imagine over the next few days, I don't know for sure when the next clinics will open up, but we will send an email out to that listserv and giving people advance notice so they know when to go on the website to schedule their appointment.
Well, that's excellent. Good. So things are getting better. And so we have less to talk about, right?
Yeah, I think things are getting, we tend to get into a little groove with things, right? So, for such a long time, we were focusing on prevention and investigation and contact tracing, and now we're really focused on vaccine. And I think, for whatever reason, here in Union County and across the nation, we definitely have seen a decline in cases. We've also seen over the course of the past year, I actually realized today that we stood up incident command at CHD for our COVID-19 response exactly a year ago today. So we've been in a structure to respond to COVID-19 for 1 year. We have seen ups and downs throughout that whole year. We have seen our cases drop and we have seen our cases rise. And so, we do know that there is still COVID-19 in the community. Somebody said that in a meeting that I was on today. So I think we do have to remember that it's here. I've said before, I think at this point, we all know what steps to take to keep the numbers down. And so, just really, I think sometimes for me, when the numbers go down, it definitely is easier to drop my guard and not be as worried or concerned. But we still have to keep taking the steps if we want to keep our numbers down. And I don't need to tell our community what they are because we've been living with it for years. We all know.
Yep. And then here's a shout out to those people, again, that are teamed with you guys to help you do this. Do you want to mention any of those folks?
Yeah, I'm really glad you brought that up. So, one of the things we've been doing these vaccine clinics, and we're vaccinating between 250 to 275 people on those days. So we do that many doses in one day. So you can imagine that takes a lot of help. So we have people that are doing the screening when people walk in the door, right? They make sure they're not sick. They take their temperature. We have people that make sure that they know how to move through the facility. We have intake. We have data entry. We have people tracking doses. We have people giving doses. We have people drawing the doses. And then we monitor people while just to make sure they don't have any reactions before they leave. This takes a lot of people. And in Union County, we are so fortunate to have so many people that have stepped up. So obviously, our team at CHD has been working on this, and there's so many of us at CHD that are pitching in to help with the vaccine events. I know I go down there a couple times a week and help, and a lot of our CHD staff are there, but we also have a ton of volunteers from our community partners. So, Grand Run Hospital, their employees have been helping us with many of the roles. We have Northeast Oregon Network, who's been helping us, American Red Cross. We have some local EMTs that have been volunteering to help us. So just a huge group of volunteers that have stepped up to help and that are really making this possible. And I may have said this before, but it's definitely one of the reasons I love living in Union County so much, because I feel like we are all in this together and people are so willing to help and so care so much about our community. And we're just, we're really lucky to live here for a lot of different reasons. I'm pretty grateful.
Yep. And today the sunshine and the beautiful snow and mountains is one of those things. And I'm sure that as people experience more of this freedom, we want to encourage them to continue to be diligent, wear the mask when you should, keep the distancing the way that you should. And, I think about that sometimes when I'm maybe not as careful as what I should be. It's like, man, I hope that I don't go back to this moment and have to remember everyone that I was in contact with in this particular moment, because that still is a reality of things that's out there.
Yeah, definitely. And I even walked into a store last night. I was so worried about making sure my kids had their masks on. I walked into the store and I was like, wait a minute, something's wrong here. I didn't have my mask on. Mm-hmm. So, I think it's like we get into our routines, and sometimes we even somebody like me who's literally living this every day for the last year, we're human, we forget. And I think it is really easy to get in the mindset that like, oh, well, we're moderate, so it's not that bad, we're good and we can relax a little bit. And, I think we can definitely feel grateful that our numbers are lower and feel grateful for the fact that our businesses are open, but we can see that our numbers can change really quickly. So again, wearing our masks when we should, I think by now I'm pretty used to it. I even notice now when I don't have it on, even though when I walk into the store, I realize, oh my gosh, something's wrong here. I think it's, we just have to keep it up. And I know I don't have to tell everybody that, but I just want to see our numbers stay moderate. I want to see us get down to low, and I know that we can do it.
Well, and as Matt pointed out, that's kind of what's going to keep businesses open, and so yeah. If we, if we want to help our businesses stay open, along with buying things from them and supporting them, we can do our part to not put other customers at risk, which might, affect them in a negative way. So, well, Thank you, Carrie. Is there anything else you want to talk to us about before we take off?
No, I think we've covered it. Definitely subscribe to that listserv if you want information about upcoming vaccine clinics, and hopefully we'll be opening some up here shortly for next week. And we'll keep doing it as long as we get vaccine and get everybody covered that wants it.
Excellent. All righty. Well, thank you. Thanks for coming on.
Thank you.
And thank you, Eastern Oregon, for jumping in with us today.